Hey, Stephanie Cudjoe here with Bloom Med. I just want to come and talk a little bit about stress management and our breath. Apparently, a lot of my patients are forgetting how to breathe in a way that reduces stress. What it winds up doing actually is worsening anxiety symptoms and that sense of tension. So I found myself in the visits when I'm listening to people's breath sounds and the lung exam that they're breathing like this. Take another breath. Just had 2 today already this morning. So I've been finding that we're giving little lessons on breathing, and so why don't we just talk about it here? If you ever look at a baby, and I have my 18-month-old, when he is sleeping, he does not breathe like this. He breathes from his belly and his diaphragm. When he breathes in, his belly comes out. When you breathe out, the belly goes in. Okay, so breathe in, belly out. Breathing out, belly goes in, almost like someone's sucker punching you. Okay? When you do that, you actually increase negative pressure into the lungs that brings the air in. It kind of sucks the air in versus trying to force air in. The other thing it does is it's a much more natural state. You don't use all of these accessory muscles here in the neck, in the shoulder blades, or even here into your clavicles, and that can cause something called costochondritis, which is an inflammation of the joint between the cartilage and the ribs. So it's very common if folks are having tenderness here, that I also notice that there's maybe some tenderness here, there's a little bit of swelling or muscle tension here, and so we start talking about stress from that point. It's not necessarily the easiest thing to do when you've been in the habit of breathing in the opposite way, where you're breathing with all of these accessory muscles. But the thing is, when you're breathing like that over time, you wind up only using about this much of your lungs. And all of this is just really not being used. And there's so much more potential in your body. So we want to, use your lungs to its full capacity. Some folks don't do that until they're exercising. They know how much better, they realize how much better they feel when they're exercising. Part of that is because their body is fully oxygenated, right? It forces you to breathe in that way. Otherwise, you pass out. So we don't want you passing out when you're exercising. We don't want you passing out or feeling lightheaded and dizzy when you feel stressed or having a panic attack because the anxiety is going, out of control. We want you to be able to control your breath. When you control your breath and you breathe deeply, breathing in and belly going out, breathing out, belly goes in. You do that on a repeated basis, you wind up activating something called your parasympathetic nervous system, which is responsible for resting and digesting. Your heart rate goes down, your blood pressure goes down, your muscles relax, and it's something that you can do within a couple of seconds. It immediately works. This is faster than any medication that can be given, even by IV. There's lots of anxiety medicines out there. This is faster than that. If I have a patient that's having an active panic attack in my office, I don't give them anything. I just show them how to breathe, okay? And it works. The other thing that I would make a note of is that it's really hard to take a nice deep breath like I just demonstrated with your hands clenched, okay? Or with your legs crossed. So you want to make sure that you are sitting and resting, that your hands and your palms are open and not clenched, and that gives your whole body the same signal that we're going to go into the parasympathetic side, the resting and the digesting part of our autonomic nervous system. When we're breathing in the opposite way, that does a whole other side of the autonomic nervous system called sympathetic side. You may have heard the fight or flight response. Yeah, that's when your muscles are tense, your pupils are dilated, You are what we call hypervigilant. You're looking all around. You may be a little jumpy, feel a little antsy, and your hands, notice they tend to clench. Okay, so we are going to notice how our body is positioned, and we're going to use maybe some timers to start practicing deep breathing. And as you do that, you will notice that things may not rile you up quite so much, that your thinking is a little bit more clear and focused. This is a practice that you know, everybody's got Calm apps on their watches or on their phones, breathing apps, relaxation techniques, stuff like that. It's not magic. It's not hocus pocus. It's biology and physiology, and it does work. So I encourage you, if you're having some issues with managing stress or feeling like you're short of breath a lot, having rapid heartbeats for no apparent reason, let's just try slowing our breathing down. Let's try breathing with our belly and our diaphragm, and let's see if that helps. All right, hope this has been helpful. Have a great day. See you next time. Bye.